Hi, my name is Emily Dingle, and I'm going to be talking a little bit about one-to-one discussion, also known as one-to-one instruction. It is one of the various types of teaching methods that can be used. A little bit about one-to-one discussion. It can be broken into two parts, formal and informal. Formal is when it is planned, and informal is when it was unplanned and kind of spontaneous. In a formal setting, the teacher prepares a specific topic that they want to educate the learner on. They can also prepare any kind of props or resources that they want to use in order to teach the learner. In an informal setting, um, it's pretty much when the educator just notices a readiness to learn in the individual or the patient. It could be either. Um, Sometimes they notice a barrier that the individual isn't understanding or they're not doing something properly, such as a skill. It may even be that the learner is asking to know more about a specific subject or a skill. It's pretty self-explanatory in that it is focuses on the individual learner. It's not a group, it's a one-on-one with the teacher and the learner being face to face and in person. These sessions of one-to-one discussion or instruction are usually in 15 to 20 increments. And because of this, it is based on quality over quantity. Um, the importance of this kind of learning is that the learner doesn't get bombarded with a bunch of information. What's important is that they learn in little bits and that what they're learning is retained and they can use it in the future, or they can be able to do whatever skill that they're learning successfully. Um, Really, this can be used in any of the three domains: psychomotor, affective, and cognitive. Um, a one-to-one discussion or instruction teaching method can be used to teach a skill, to inform any kind of knowledge about a subject, or change an individual's thoughts, sometimes about cessation, about a bad habit. Here's a video that I thought was really interesting. It kind of really breaks up the three different domains and it allows you to understand it a little bit better.
Much as the butcher conveniently divides a cute, fluffy chicken into delicious pieces, academics divide the mechanisms of human learning into three domains: cognitive, psychomotor, and affective. The cognitive domain involves intellectual skills and organizes those skills in a hierarchy based on degree of complexity. Relatively simple skills, such as the learning and recalling of the facts, are placed at the bottom of the hierarchy, while more complex skills, such as analysis and synthesis, are placed on the top. Not surprisingly, this domain is most often the focus of the educational system. For example, a student of literature might first memorize facts about Hamlet. Later, that student would write essays analyzing the theme of revenge or some other crap. At the highest level, the student would draw from the lower level skills to create original works of literature, preferably superior to those god-awful Twilight books. Sparkly vampires? Seriously? The psychomotor domain involves the adoption of skills requiring hand-eye coordination and other physical tasks. It doesn't have a whole lot to do with library instruction, so we're going to skip right on over to the affective domain! Yay! Which involves attitudes and values. It describes how people progress from ignorance of a subject to making that subject an integral part of who they are. At the lower levels, a person learns that a subject exists, chooses to pay attention to it, and responds to it with goodwill. At higher levels, the person makes an effort to interact with the subject, eventually making it a determining force in his or her life. For example, that same student of literature would begin by becoming aware that Hamlet exists, decide to read it, and enjoy the experience. Later, the student would acquire other plays and read them, maybe attend a performance. At the highest level, the student would come to appreciate literature as something of enduring value, and make it a permanent part of his or her life. This three-way division exists purely for academic convenience. Learning domains are actually deeply interconnected, like the chicken is to its wings and drumsticks. Just as the chicken becomes significantly less cute when subdivided, learning tends to suffer when domains are addressed in isolation.
So that video wasn't specific to any kind of medical subject, but I really think that it helped break up the separate domains to have a better understanding of how they're all interconnected and important individually. Some pros of one-to-one instruction are that the pace can be tailored to meet the individual's needs. Um, Based on if subjects may need to be repeated, or if someone understands a subject, they can just kind of brush over it instead of diving deep into it. That's based on the learner and whether or not they're understanding the information, what they already know from previous encounters. It also is very ideal for assessment and evaluation that involve the learner and the teacher. It allows for it to be quick. It can be during the teaching as well, and it can be adjusted to fit the needs of the learner, kind of like when the pace is tailored. The teacher is going to immediately know if the learner is truly understanding the information and if they're retaining it, and the learner is going to know whether or not they're understanding the information, and that allows them to be able to ask questions, seek clarification. And that kind of ties into that there's immediate feedback between the learner and the educator. There's really no barrier because they're face to face. It's in a comfortable setting. It's one to one. They can ask questions. They can make sure that they're understanding the information. Anything can be repeated or showed again. Some cons or negative aspects of this teaching method is that it does isolate the learner, and for some people that can make for a very uncomfortable situation or experience. Not everyone likes the one-to-one attention. Sometimes they like to be in groups, and in that aspect it deprives the learner of allowing them to learn in a group environment. Sometimes people really can build off of group learning because they're with a lot of people that need the same type of information, and it makes them feel more comfortable. So that kind of ties into anxiety because people who aren't comfortable in one-to-one situations, it can make them be very anxious as well as overwhelming because they are the focus of this learning session. And some people aren't used to that or don't like it. It can also cause a misinterpretation between the teacher and the learner because a lot of the time during one-to-one instruction, it needs to be assessed frequently whether the teacher is allowing the learner to understand or presenting the information in a way that the learner is able to understand and retain the information. A lot of the times the educator will use open-ended questions to see if the learning is productive, and some people may interpret that as that they're being tested or quizzed, and that can be more of a negative aspect, but really it's just to see if the teaching was successful. So a lot of the times during these one-to-one sessions, the teacher needs to clarify that, I'm not trying to see what you don't like. I'm not trying to just make something up so that you don't know the answer to it. It's truly to see what we need to go over or what we might not need to touch on as much. In certain situations, this kind of learning can be very costly because it is a one-to-one situation. So there's only one person receiving the material on this. So, for instance, in a clinical situation, such as when a new nurse or new grad or new nurse to a new care area is being precepted by a more experienced nurse, that is mostly one-on-one, and it costs a lot of payroll dollars as well as hours, whether or not it's, like a constant one-to-one instruction or if sometimes it's sporadic. Sometimes it can be a little more cost efficient if there are certain parts of clinical aspects that can be taught in a small group. Some examples, one we just touched on was the preceptor and the preceptee. So for a new nurse or new grad, anything that they're learning on the job specific to a certain care area would be an example of new skills or new knowledge information. Patients even learning new skills, such as maybe a new diabetic learning to give insulin injections to themselves or testing their blood sugar, or even someone who hasn't taken medications daily and they have to learn when to take them, why they're taking them, when's the best time to take them, what to take them with. And it can also be used for a cessation of habits such as smoking cessation, or maybe diet controlled for the person who has a high BMI, high cholesterol, or is obese, or even the new diabetic that needs to change their lifestyle choices of foods daily. This kind of teaching method can be used in various different medical aspects, whether it's professionally or with the patient.